Thank you for taking part in WorkSafe's Health and Safety Month. Today, we are using a couple of Ambulance Victoria case studies to look at early intervention, working together to improve outcomes for injured workers. My name is Natalie Wellard, and I am a Manager of Legislative Services and Reform in External Affairs here at WorkSafe. I'll be your host for today's session. I am joined by Lucas Kowalski. Hi, Lucas. Manager
Morning.
of WorkSafe's Return to Work team. Nabil Nizam. Hi, Nabil.
Hello.
Manager of Return to Work and Compensation Management at Ambulance Victoria. And Adam Guilano. Hi, Adam. Practice Group Manager at DXC Claims Management Services. Thank you all for joining us. So this session is going to run for about 45 minutes. In the first half, we'll learn about the return to work process and the importance of communication and engagement between the injured worker, the case manager, the treating health professionals, and the employer. And we'll learn about those through 2 Ambulance Victoria case studies. Then we'll open up for audience questions via the chat box on the right-hand side of your screen. Please feel free to enter your questions at any time from now so that we have them ready to go when it comes time to the QA. And finally, some of our content today may include material of a sensitive nature and may be a trigger for some people. If that's you, please feel free to walk away from the webinar and rejoin when you think you can. Alternatively, if you have any specific questions about your individual circumstances, please give WorkSafe Advisory a call. So let's get straight into it. Early recovery and return to work outcomes can have a positive impact on not only the worker, but also their family. The employer is also able to have back at the workplace a skilled and valued member of the team earlier. The employer and the worker both contribute to the success of safe and sustainable return to work post a workplace injury. But for today, we will focus on what an employer must and can do to deliver a safe and sustainable return to work. So Lucas, I'm going to start with you. What are the obligations of an employer?
Thanks, Natalie. So as you mentioned, there are some obligations for the worker, but there are also several for the employer. These are outlined in the Work Act 2013. So the key one is, of course, provision of suitable duties post-injury for 52 weeks. But what I really wanted to focus on today is Section 104 and 105. So this refers to planning for return to work and also consulting about return to work. On the screen, there's a document that is referred to as our Return to Work Compliance Codes 104. This is a reference document that employers can access, and it expands on those obligations, Section 104 and 105, but also the other obligations in the Act as well. And it does provide some practical advice for employers to assist them with meeting those 2 obligations. But really, with respect to 104 and 105, employers must plan for return to work and consult about any proposed return to work. And they're summarised in the Work Act, but then also, as I mentioned, expanded on within the Compliance Code 104 as well.
Thanks, Lucas. I'm going to stay with you. The concept of early intervention is often referenced in workers' compensation. It's in the title of our webinar today. But what does it actually mean for employers?
It's very different based on the size of the employer. I mean, it could be really starting off with a process or a procedure that documents the minimum steps that should be taken and must be taken by the employer post a workplace injury. But for larger employers, for example, the early intervention programs do include certain support services that the employer will introduce post a workplace injury. And that will really depend on the type of workplace, the type of employer, and the type of injury as well. But we really encourage employers to consider that written policy approach initially as well, but then any kind of other programs that may be appropriate for their workplace insofar as early intervention post-workplace injury within their own business as well.
Thanks, Lucas. I'm going to turn to you now, Nabil. You work at Ambulance Victoria, and Ambulance Victoria is recognised as a sector leader due to its strong performance in supporting return to work outcomes for injured workers, both with a mental injury and a physical injury. So what is the Ambulance Victoria focus here?
Thanks, Nat. So I think our approach or the focus is fairly straightforward. We try and get the right people involved at the right time and as early as possible. This is generally as soon as an incident has occurred. Now, this might seem like an obvious statement in contemporary injury management, but for it to work well, I think we need the various moving parts of the process to work in unison and effectively to support the injured worker. And I think we're fortunate that all these moving parts have been working really well for us with that single objective of supporting the injured worker through the recovery. We've also stuck to the basics and not really reinvented the wheel. AV has fostered a culture of prompt support to the injured worker. And we engage the right people, be it the THPs or the DXC support, AV's internal support services like the wellbeing support services that we have. And more importantly, the injured worker becomes really an integral part of this process, naturally resulting in that holistic and person-centered approach in return to work management.
Thanks, Nabil. And do you have some figures there for us today?
I do. So in 21-22 financial year, our return to work, 6 months return to work performance was at 80.11%, and that's compared to 64.51% for all emergency services. Our mental injury claims performance for the 6 months return to work was at 58.26%, and that's compared to 41.54% for all emergency services.
It's really impressive. I'm going to stay with you, Nabil. What are the characteristics of your approach that you think make it so successful?
I think there are a few things, Nat. So the safety and return to work primarily is espoused throughout the organisation at all levels. I think that's a key factor. This has resulted over time in a really strong incident reporting culture. The incident reporting requirements are clear and embraced throughout the organisation. And this in turn has triggered the return to work team and the managers to get involved in the return to work process promptly and as early as possible, as I touched on earlier. Our return to work coordinators also have health and safety and HR support people in the team. That really provides a well-rounded support system to some of the more complex claims and return to work matters. The relationship between return to work coordinators and managers is really good. It helps them source suitable duties from various areas of their respective region. And to further support sourcing suitable duties, we've just implemented a suitable duties repository, which is an online portal where managers from across the state can log in their available duties so that return to work team can place injured workers appropriately into those roles. I think another factor supporting this is our overarching governance program. There are injury management and return to work KPIs set across all levels of the organisation, regular monitoring by management, and really good collaboration with the return to work team has assisted in understanding performance from a high level, but also at an operational level as well. And above all, our people, I think we have a highly experienced return to work team. We're fortunate to have that highly experienced return to work team. They've been with us for some time now. They understand the challenges and barriers and risks of their respective region. Our team's divided into 4 or 5 groups, and they have their allocated region within Victoria. That helps them to understand the risk profile specific to the area, understand the barriers and challenges, and cater the return to work plans and arrangements to the injured worker and for that specific region. So I think all of those put together is really that's driving our return to work performance at the moment.
Thank you, Nabil. I can definitely see why Ambulance Victoria is a sector leader in this area. So Adam, I'm going to bring you in now. DXC is Ambulance Victoria's agent. Could you outline how DXC supports Ambulance Victoria and other employers to meet their return to work obligations?
Thanks, Nat. So as Lucas and Nabil have mentioned, and in focusing in on sections 104 and 105, we can help an employer meet their obligations by talking to and obtaining relevant information from an injured worker's treating health practitioner. And we can do that in a couple of different ways. So that might be via us arranging a mobile case manager intervention visit. We can call and have a chat to a treating health practitioner, and we've got various different roles at an agent that can do that. So we have injury management advisors, we have doctors that assist us work on claims, and we call them medical advisors. We have mental injury specialists that can help with such communications. We can request reports from treating health practitioners. There are some other supports that we can offer in terms of workplace support. So we can refer for an occupational rehabilitation provider to assist you. We can also ask an injured worker to attend an independent medical examination and follow that up with what we call a workplace visit, where the doctor will come out with the employer and the injured worker and inspect the workplace and see if there's anything that we can offer. So these are just some of the tools that we can use to help an employer meet their return to work obligations.
Thanks, Adam. So I can see that the employer does have a number of obligations that they must meet following workplace injury, but there is that relationship between an agent and the employer, such as DXC and AV and Ambulance Victoria. So Nabil, I'm going to turn back to you. I believe you've got a case study you'd like to talk us through from your work at Ambulance Victoria.
I do, Nat. So the one that I have is unfortunately somewhat common in terms of injuries that we see, purely because of the risk profile and the nature of, I guess, the industry that we're in, which is emergency services. And I'm actually referring to our staff being exposed to traumatic events and incidents. So this one's about a graduate paramedic who responded to a Code 1 traumatic incident. Unfortunately, the worker was previously exposed to a different incident about 6 to 12 months before that. So there was that compounding effect when the worker was exposed to the second incident. Obviously, the worker was, unwell and took some time off, but the manager was quick to contact the worker over the phone soon after they took some time off, had a really basic conversation around how they're going, but also arranged to meet with the worker in the workplace in person. I think this really set the tone and set the return to work process in the right direction, albeit the worker was not coming back to work in a formal sense. In this meeting, there was a bit of a discussion around the worker's condition, diagnosis, perception, what they can and can't do, and so on. And given the severity of the condition, the worker opted to go through the work cover process. The return to work advisor was engaged soon after. Another review was done around what the worker's condition was. Treaters' reports and opinions were gathered, and a plan was put in place with the workers' collaboration and reviews in place. So the worker was taken off road immediately, and suitable duties were offered to the worker in an administrative area, and we were able to achieve a return to work soon after. Unfortunately, though, there was a bit of a relapse in the worker's condition, which meant that the worker had to take some time off. Again, the return to work advisor promptly got involved and supported the worker through that episode, tried to understand what was going on, engaged the THP, engaged the DXC, and revisited that return to work arrangement. Something else that the advisor did was spoke to the injured worker's family members with the consent of the injured worker, of course. What the advisor realized was the condition and the symptoms of the injured worker was sort of trickling into the family members, and they were getting impacted as well. And the advisor offered the family members counselling services as part of that holistic support of the return to work process. A revised return to work plan was put in place, and the worker again came back to work. Soon after, an independent medical examination suggested that the worker is fit enough to come back to pre-injury duties. Now, having the injured worker seeing all these support systems that was available to her throughout the process, the worker voluntarily made an attempt to come back to pre-injury duties. And weeks afterwards, we received a clearance from the treater. So overall, I think traumatic events for us is complex. They result in quite severe illnesses, and they can be challenging in the return to work process. I think going back to my earlier point around what we do in terms of the basic things, that is to get the right people engaged at the right time as early as possible, happened really well in this instance. The engagement piece was pretty good in that it set confidence in the worker to come back to work and stay at work and then build on from there, which ultimately resulted in a successful return to work and back to pre-injury duties as well, which is what I guess we all want.
Thanks, Nabil. It's a really detailed case study. It definitely shows the factors that make Ambulance Victoria a sector leader. So, and great outcomes for the injured worker. So thanks for sharing. I'm going to turn back to you now, Lucas. How do you think employers like Ambulance Victoria and their agents like DXC plan for return to work so well?
I think the call out, of course, is that not every employer may have access to the same resourcing that an employer like AV may have, or larger employers as well. So, for example, smaller employers where there are a small number of employees, etc. So, but I think the key message, and Nabil's touched on it as has Adam as well, is that early communication between the stakeholders, where we have done some work around speaking to workers and/or employers, or reviewing claims histories where the worker hasn't returned to work. A lot of the early opportunity was really that communication where it hadn't happened or it was extremely poor. I think it's really important for employers to consider taking a step back around insofar as removing the emotion from the process, being really objective about planning for return to work and really focusing on the facts. So I guess other than what Nabil and Adam have also spoken to, for employers that don't have the resourcing within their own business, it's important for them to consider what support their agent can offer. So whether it is a mobile case manager visit, it could be one of the mental injury specialists making contact with their worker and their psychologist, for example, or a referral to one of our occupational rehab providers to support some of that early return to work planning. So the key message for me is the communication early on and consistent, transparent, but then also speaking to the agent about the support services that are available if the employer just doesn't have the capability or the capacity to drive that return to work process as well.
Thank you, Lucas. Adam, you mentioned earlier, and Lucas touched on it just then as well, a couple of key roles, such as mental injury specialists or mobile case managers. Can you expand on those and tell us how you use them in your work with Ambulance Victoria? And maybe you could use another case study.
Yeah, absolutely. Thanks, Nat. So the mental injury specialist is an agent role. It's a person who has a background in a mental health, and they're a resource for us to tap into as to how to best assist somebody with a mental injury. So they can review claims and they help us set appropriate strategies to assist an injured person back to recovery or return to work. They can assist your case managers to execute strategies as well, such as, and what Lucas said, having a chat perhaps to the psychologist with the injured worker. They can suggest to us the best way to manage and help somebody with a mental injury, how to talk to a psychologist, and they can even join in with a case manager in that mobile case manager intervention. Speaking of which, so the mobile case manager intervention is where we as an agent for WorkSafe bring the parties together, the injured worker, the employer, their treating health practitioner, the occupational rehab provider. We're discussing the issues and we're putting some actions in place to help the injured worker recover and ultimately return to work. So now moving on to a small case study. We recently had a claim where a young graduate paramedic sustained a shoulder injury in the course of their normal work. They saw the surgeon very quickly and early on, and the surgeon advised them to, rest the shoulder, but more importantly, there was no need for any surgery. The treating physical therapist in this case continued to certify the injured worker as unfit for all work. And this went on for perhaps a little longer than we may have expected in such a case. So through regular communication from the case manager at DXC and the return to work coordinator at Ambulance Victoria, it was discovered that this injured worker was particularly apprehensive about any return to work, even in a partial or reduced capacity. So upon this realization, the case manager arranged a mobile case manager intervention visit with that treating physical therapist to talk about the issues and a potential return to work. Now, before that visit, the AV return to work coordinator and the case manager got together and worked through some of the possibilities that a paramedic with a shoulder injury might be able to do. They brought these duties with them to that mobile case manager intervention visit, and both the physical therapist and the injured worker did agree that they should be suitable, but they did want the surgeon to just confirm them at the next appointment. So some of the actions that the claims teams did after the visit was they finalised that return to work plan. They encouraged the injured worker to bring a copy with them to their surgeon's appointment for review. At that appointment, the surgeon confirmed that the duties were suitable, and that worker eventually made a return to work, which was a good outcome in this case. So in that example, you can see how together Ambulance Victoria and DXC have contributed towards the injured worker's return to work through the planning and consulting sections 104 and 105.
Thanks, Adam, and thanks, Nabil. I can definitely see the collaboration between Ambulance Victoria and DXC, and also the supportive environment for the employees as well, having that collaborative effort between the agent and the employer can really provide that support for the employee to get them back into the workplace. So, Lucas, can I ask you, by way of summary, if you are an employer with an injured worker who is looking to return, what would you like our audience to take away from the session today?
Absolutely. So I guess, again, there will be a different approach for employers of different size. But I think the first thing is for all employers to have something documented, like a process or plan. So what key things must occur following that workplace injury? So the submission of the claim forms, and of course, the injured worker getting the appropriate medical care as well. I think employers should understand that they start considering planning for a return to work and what that might look like once their employee or worker has a capacity for work. I mean, the example from Nabil was quite positive insofar as having a library of suitable duties, and that's not possible for every employer, but even for some of the small, medium employers, considering what alternative work one of their injured workers could complete as part of their recovery as well. If the worker is unfit, employers should still nonetheless consider planning and consulting about return to work. And the best example is that most recent one from Adam, where the return to work plan was presented to the worker, and it's involving your employee as part of that process. So we do expect that the employer identifies suitable duties as part of a return to work plan, but it really is important to involve the worker and consult with them about those duties, because they may be able to identify something that the employer themselves hasn't been able to put forward. And of course, we do want employers to consider the support services that our scheme can offer. So again, mobile case management, a mental injury specialist, an injury management advisor, an agent, or of course a referral to either occupational rehab. And for a physical injury claim, as Adam's mentioned, and an IME and then worksite visit is quite an informative support service where an occupational physician will visit the workplace and as part of their report will actually propose some suitable duties that they identified with a clinical lens as being perhaps suitable for the worker as well.
Thank you, Lucas. And thanks, Nabil and Adam, for sharing your insights around the return to work process and the importance of communication and engagement between the injured worker, the employer, the case manager, and the treating health professionals. So now it's time for us to take some questions from the audience, and there are a couple, so I'll read them out. Lucas, I might start with you because this is a pretty general one. If an employer has prepared a return to work plan and sent it to their worker and their GP, but hasn't had a response from anyone, what do they do? What options are available?
So this is obviously really important. Consultation is very, very important. So the employer's done the right thing in that regard. There may be some circumstances where the GP just isn't aware that it's been sent to them. But I think the other issue is around how we bring the prominence to the communication with the GP. So I encourage employers to actually call the GP, discuss the document that's been sent through, and even consider arranging to have a conference with the GP and the worker as well to discuss the document that has been prepared. And if they're not getting any traction in that regard, then tapping into the mobile case manager and an agent, for example, to and formalise a visit via a case conference where they'll send out some documentation to explain what the purpose is and so on. It really is trying to identify perhaps also why the GP hasn't responded. It could be that perhaps their primary focus is on the worker's recovery, and in that case, it's really about trying to reinforce that this is about bringing them into the collaborative process about return to work. So again, follow-up phone calls, I guess tapping into the mobile case manager, a resource at an agent, and trying to arrange a case conference, for example, to discuss that return to work plan with that GP, or I guess any other allied health provider that's supporting the worker with their recovery and return to work.
Thanks, Lucas. Nabil, do you have anything to add as an employer?
No, I think Lucas really touched on the more important parts there. For me, it's more about the collaboration piece. I think, as I touched on in my first bit there, it's to get the right people involved, and in this case, it is the agent, the return to work advisor, and the manager to ensure that everyone works in unison towards that objective. So, I guess to that end, Lucas has covered up really well.
Thank you. Okay, so another question. So I'll stay with you, Nabil. As an employer, if an employee report is a stress claim but doesn't communicate with the employer, what options do you look for?
Yeah, that's a challenging one, isn't it? And it's not really uncommon because depending on the type of stress claim, it can be that they might have some interpersonal conflicts or things like that. So we do try and use different levers, I guess. We work with the agent primarily, but before we go to the agent, we try and work with some of our internal mechanisms in place. So we speak to the manager and understand through the manager, we try and understand what the issues are and see if there's any other means that we can connect with the injured worker. We also have the return to work advisor, who is the conduit of all of these, but also we work with the agent to ensure that there is that communication piece that comes through and that the linkage in terms of bringing everyone together. And we use the agent to, emphasize and understand the obligations of the injured worker in terms of participating in the return to work process. So there are a few options that we use depending on the case, of course.
Lucas, Adam, did you have anything to add?
I might just add, as Nabil has mentioned, it is not uncommon, but there is, a support service for employers and workers to consider. It's called facilitated discussion. About 3/4 of our mental injury claims are due to a conflict in the workplace. So it's a voluntary service. The agent may discuss it with the injured worker and seek their participation, and then also with the employer. And what it is about trying to identify those barriers to return to work and the expectations of the worker as well, of the employer. So the service is called FD, Facilitated Discussion, and the primary structure is two parts. Part A, where a specialised consultant will meet with the injured worker separately and then meet with the employer separately to really understand different points of view. And then if both parties are agreeable, then they will bring them together to try and work through some of those challenges. So that's something for employers to discuss with their agent. The agent will then discuss that with the injured worker as well. And then maybe a bit of a conversation with their GP and the treating health providers, like a psychologist, for example, to reassure them of the purpose of the process and what support's available to the worker, for example, including them being able to bring a support person to the meeting as well.
Great, thanks, Lucas. Some very good options for an employer in that circumstance. So I'm going to throw to you, Adam, now, but I think Nabil, Lucas, if you have any tips as well. But how can you go about sharing information without breaching privacy or consent, especially if it's a mental health claim?
Sure. So I assume that question is how can we share information with the injury employer? So we can give the injury employer extracts and excerpts of information that we have that relate to the injured worker's return to work. So, for example, if we had had a chat with the treater, we potentially may not go into detail about the treatment plan that the injured worker is undertaking, but we might say that a return to work is likely in a couple of weeks' time, or return to work is ready to go now, and these are the restrictions that your injured person needs to be able to come back to work, so that you as an employer can then use that information to help you plan for that return to work.
Thanks, Adam. So I've got another question I might throw to you, Nabil, as an employer, because I think that Ambulance Victoria might get this a little bit. So I'm sure you've got some good suggestions. Any suggestions on how to address rumours or stigma that may arise if a person is off work because of a mental injury?
Yeah, one of the key things that we advise, and especially in our training programs that we do at AV, across the state is to try and sort of delineate between the noise that's there with regards to the issues and then the return to work and the claims process. And that should start really from when the incident occurs and when the worker decides to lodge a claim. It is very common in work cover that we see that the noise gets tangled into the claims process, especially in the eligibility process, and then we lose a lot of opportunities in the early return to work, right? So one of the things that we recommend is that to try and focus purely on the return to work, and that is, like Adam touched on, what's the capacity, what's the diagnosis, can we work with the THP to try and get the worker back to work? Now, that's potentially a perfect world sort of a scenario, but we understand that there are nuances to work cover claims in Victoria. So as much as we can, we try and focus on the return to work aspect of it. The agent takes care of the entitlement side of things and other issues. So where there are concerns, we certainly talk about those with the agent. But as an employer, our primary focus and the role is to look at return to work and support the worker through that process.
Great. Thanks, Nabil. And Lucas, did you have anything to add about, I guess, destigmatisation? If that's
I think I might. Yeah, no, I'm happy to also add to the previous question because I think Adam touched on it around sharing information. I think for employers can be part of that collaborative process with a case conference. So, for example, it may be an opportunity for an employer to ask some questions, attending a case conference with the worker and their THP GP, for example, to help them understand how they can best support their employee with return to work. So they may not be able to be provided with the full report, for example, but it may be that they're part of that discussion. The other thing is that if the employer, if the worker is referred to OES, Original Employer Services, which is facilitated by our occupational rehab providers for return to work goal with the pre-injury employer, copies of those reports are shared with the worker, the employer, and the treating health provider as well. So that is a very collaborative process in that regard as well. But I think it's a challenging one back to the most recent question around the stigma, because I think it really will depend on the size of the workplace, of course. If there's a smaller workplace, a small number of employees, and one is off work, I think those employees are probably looking for a bit more support as to what to do with what's been left, perhaps as well, the unknown of having one of their colleagues off work. So I think it's a challenge for an employer to be able to address those that are still present, but be able to plan for the return to work of their injured employee. But I think it also comes back to that transparency early on as to what does happen when someone is injured. That way, all employees are aware that if someone is off work for a physical or mental injury, the support that is available is X, and that perhaps may take away some of the unknown when one of their colleagues is away as well.
Great, thank you. So Adam, I'm going to throw to you because I think that this is a bit of a variation to the example or the case study that you raised. So if an employee claims that they are unable to work, even if they've got clearance from their GP or surgeon or other treating health professional, what is the employer able to do in those circumstances?
Yeah, that's a good question. So in that situation, I would certainly start by talking to your agent and working through some of the supports that are available. And maybe the answer is, in that situation, let's get together with that treating health practitioner who has certified or written a report to say that I think, the injured person can come back to work. And let's start there and work through, well, what would a return to work look like? These are the sorts of duties that I might have available in my workplace, and try and collaborate from there.
Thank you, Adam. Nabil, Lucas, anything to add?
I mean, I've come across circumstances where agents have discussed very similar scenarios with us, and I think that it's always about going back to the ongoing barrier to coming back. So is there something else underlying that is preventing that person from returning to work? Or I think a clearance from injury to return to work is obviously the sign that medically that person is able to return to work. So that that would have an impact on what they're entitled to under the accepted claim. But then it's really understanding what else can be introduced to bring that person back. It's going to be a bit of unpacking as to what's happened to get to that point. And we'd like to, a piece of paper with a clearance is one thing, but we'd probably like to have a discussion with the treating team as to, okay, this employee has been cleared for return to work. They're still not in agreement or comfortable coming back. So what else is required to bring that person back? Bringing everyone together to have that discussion as well. But again, Adam has mentioned using the support services within the agent to make that happen through MCM, for example, mobile case management or other services as well.
Thanks, Lucas. Nabil, I'm going to throw this one to you. How does an employer know what suitable duties to propose for a worker's return to work?
Yeah, I think it starts with, I guess the straightforward answer is to understand the worker's condition and the capacity and what they're able to do and be driven by what the treating health practitioner is saying. That's I guess the basic answer. But again, it's, as I touched on, there are nuances to it and people are complex. What the treating health practitioner is certifying might be different to what the worker is perceiving. There is a readiness to come back to work, and then there is a clinical capacity that gets put on a certificate. So I think that's the most important thing that a return to work coordinator needs to understand and to be able to leverage that and support the worker through that process. So going back to that initial point around understanding the incident, the injury, getting earlier on in the piece and supporting the worker through that discussion. A worker might be able to lift or not be able to lift more than 10 kgs, but they might have other issues in their personal side of things that's restricting them from coming back to work. As employers, we bear all of that in terms of getting people back to work. So our focus is that holistic approach, not only just focusing purely on the work cover side of things to understand the holistic issues and needs and wants of the worker, and then tailor a program in terms of return to work. We try not to get driven too much by milestones and costs of the claim and so on, because I think costs don't exist in a vacuum. What you do earlier on in the return to work space, it triggers the costs. So if you do all of these things really well, costs will take care of itself. So to answer the question, primarily it's the certificate, but also there are other things that are non-certificate related that'll be helping in terms of return to work planning.
Yeah, great. Thanks, Nabil. Lucas, I'm going to throw to you. So this is a great question, and I think hopefully we've got some really good tips for our employer. So if an employer has never had an employee injured at work, what support is available to help them prepare before an injury happens?
I guess for the small, medium employers, I'd really encourage them to research our OH&S Essentials program. So if you just Google it or go to the WorkSafe website, OH&S Essentials is a free WorkSafe support for small, medium employers with a certain cap around the size of the business. And that the role of the consultant is to come and assist with health and safety and really triaging what supports that employer needs for their workplace. And the consultant will help that employer with planning to kind of address those risks within the workplace as well. So there's an element of return to work that's included, and that will be something that's discussed by the consultant with the employer. So it's a bit of a plan that's put together, very specific to a physical injury at this stage, to understand the risks of the workplace to prevent injury, but also to identify what the employer requires insofar as return to work kind of frameworks and programs that are missing. So WorkSafe is developing something very similar for mental injury claims. So OH&S Essentials for mental injury claims, and that's going through a bit of work. But OH&S Essentials is a key one for small, medium employers. I think larger employers will explore supports via specific providers that are out there in the community. Obviously, that there's a cost associated with that as well. But I think, as Nabil's mentioned, a lot of that early activity has an impact down the line if an injury does occur, insofar as early intervention, early support programs being identified, so that the worker is being supported throughout that whole journey after they've been injured as well.
Thanks, Lucas. Definitely our key focus at WorkSafe is prevention. Prevention is always the best approach. So we have a question here, and Nabil, I'll throw to you because it's very similar to a question you answered earlier about non-responsiveness of treating health professionals. And this is a bit more about active resistance. So what if the worker's doctor has said they will just not participate in the return to work process? What is the next action for an employer in that circumstance?
Again, it's not uncommon. We do have that. I think it's about understanding the circumstances and seeing what the levers that you can pull. So it could be, if the worker is not disconnected, then it'll be primarily speaking with the worker to understand what the issues are, leveraging any internal resources that you have, whether it's the worker's direct reporting manager or anybody else that the worker might be okay with, and then leveraging off of them to create that link. We obviously have DXC as a means to have that discussion. DXC will sort of articulate the obligations of a return to work, or obligations of an injured worker for return to work. And then obviously, depending on the nature of the doctor and so on, we'll also have WorkSafe to have those discussions around treaters who are being, completely going against, best practice guidelines and so on. So it really depends on the case, and I think it's to understand the issue at hand and then leverage off of the resources that you have internally primarily, and then go external to see what else you have.
Thanks, Nabil. I might just throw one more in the mix, and then we might have to wrap up. But if we didn't get to your question, please feel free to contact our WorkSafe advisory line. So Adam, I'm going to throw this one to you because I think this is an interesting one that you might be able to help with. So if a worker sustains an injury in the week prior to the expiration of their employment contract, what is an employer's obligation in those circumstances?
Oh, golly, that's an unfortunate situation. But look, that injured worker would still be covered by the WorkCover scheme. We would work through that particular situation with you. We would certainly advise that employer to continue to offer suitable duties if they're able to. If they're not able to, then we would support that injured worker return to perhaps a different employer.
Okay, great. Thanks, Adam. So coming to the end of the session, was there anything that you, last messages that you wanted to leave our audience with? I might start with you, Adam, since you have the mic.
Look, one of the questions we had before was about what do I do if I'm not quite sure about planning for it? Have a go, right? It's about planning and consulting, and it's a feedback loop. So you might not always get it right, but if you have somebody and you think you might be able to offer this duty, have a talk to them about it, have a talk to their treater, and using that feedback and planning and consultation phase, it'll come back to you and you can adjust, you can tweak if necessary, but have a go. And if you're not sure, reach out to your agent and we can talk you through some of the options and some of the resources that we can offer.
Thanks, Adam. And Nabil?
Yeah, look, for me, I think going back to that question around stigma, I think that's been a long-standing issue when it comes to psychological claims. Unfortunately, there's one person can't make that change. It is a cultural thing in the workplace. A lot of work needs to be done top down in terms of fostering a culture that promotes well-being and support within the workplace, and also knowing that return to work is integral, and obviously there are other factors that impact return to work. One person can't make things change, and just going back to the basics that I touched on earlier, it is a combination of factors that come together. To understand those combinations or that combination and implementing things at the right time through really good governance systems and support systems and so on. So that should really drive the results for return to work in the workplace.
Thanks, Nabil. And such a good point. I think, hopefully we've had such a big focus on mental health over the last couple of years. Hopefully as a society, we're shifting our views in that respect. And Lucas, lastly, do you have anything to leave our audience with?
Probably just even to add to one of the last questions, for employers should really speak to their agent also about return to work coordinator training. So agents can offer 2-day training for employers about the core basics around being a return to work coordinator. So for employers that have never had a claim, they may be small and it's probably something into the future. I think it's really important to consider tapping into that course, because that way they'll be prepared for if and when it does happen. But I think the key message has been really the basics, the communication, the planning, and having something that you can talk to someone about as well.
Great. Thank you, Lucas. And thank you, Nabil and Adam, for your time today. We hope you found this to be an interesting and informative session. We're really interested to hear about your experiences and feedback of WorkSafe Health and Safety Month sessions and the overall event this year. We will be emailing a quick survey to all attendees, and as a thank you for completing the survey, you will go into the draw to win one of 5 $100 gift cards. Winners notified by email or phone number if you've supplied them in November. And we'll note on the screen shortly a list of all the contacts that we've talked about today that you may find helpful if you're an employee facing return to work or if you're an employer with a returning to work employee. If you have any requests for further information, we recommend you get in touch. And remember, if there is something you want to discuss urgently, there is the WorkSafe advisory line and the emergency line is open 24/7. Thank you very much for watching.